6:43 right now. We want to turn back to our coverage of the Johnson & Johnson vaccine. Georgia's Department of Public Health pausing the vaccine for now after both the FDA and CDC recommended a pause. And that has led to a lot of questions and concerns. 11 Alive is committed to bringing you answers from the experts. 11 Alive medical correspondent Dr. Sujatha Reddy joining me live now with some answers. Good morning to you, Dr. Reddy. I haven't seen you for a while.
Good to see you, Shiva. It's been a while.
So I would imagine within your office, this had a lot of people talking, right? What would you say to those folks who are concerned this morning, who have received this vaccine?
You're exactly right. This is very concerning to people who've received the J&J vaccine or were on the list to get it. You know, I think we have to put into perspective. First, there's no absolute direct cause and effect, but it's pretty suspicious. But it's very rare. We've given out in the U.S. almost 7 million doses, and up to now there have been 7 reports of these serious blood clots. So it's less than 1 in a million. So it's a rare complication, and we just don't have enough information right now to say, is there something specific in these people? Were they on a medication? Do they have a medical condition that made the vaccine and that issue lead to these blood clots? We just don't know. So one thing to be reassured about is if you've gotten your vaccine 3-4 weeks ago, you're probably okay, because these 6 reports occurred within 2 weeks of receiving the vaccine. So I hope that gives people some, reassurance.
Is it possible, Dr. Reddy, that some cases were not reported? Could you have a blood clot and then recover on your own?
Not these particular type of blood clots. These are very serious, but I think, what you're saying is possible in that people may have developed a blood clot and had received the J&J vaccine, but not put the 2 and 2 together, which is why they're making this huge public information campaign. So if there are people who got the J&J vaccine and then ended up in the hospital or having an issue even now, we may have more cases coming. But up till now, it's only been the 6. But this is not the kind of thing that you're not going to need to go to get medical attention. It's a very serious problem.
All right. And we know that folks overseas are investigating this as well. So how do you know that you should go to the hospital? I know people were looking up the symptoms of blood clots. These were brain clots. How do you know to go to the hospital?
Yeah, that's really a very important point to make. So you're looking for symptoms that are very serious. It's not going to be like a minor headache. With the headaches that we're talking about are people often will describe as the worst headaches of their life, or, it's something very different for you. You're looking for swelling in an arm or leg. You're looking for really stroke type symptoms. So some of these patients that develop these blood clots have trouble speaking or get weakness on one side of their body. So any neurological symptom like that, severe headache, it's going to be a very significant symptom. And if you have any doubt, you call your healthcare provider, or if it's a serious concern, you go to the emergency room.
Yeah, one of the women who spoke to NBC Nightly News said that she initially went to the doctor, to the hospital. They said, you'll be fine. And then some days later, her leg was really swollen. So that was a big sign for her. To close this out, Dr. Reddy, for people who are just having some vaccine hesitancy, this has kind of sped things up for them. They want to wait a little bit longer. What would you say to them, those folks who are hesitant to get it now because of these new developments coming out from the J&J vaccine?
Yeah, I understand that concern, but I think we have to put into perspective the fact that we've given out 100 million doses of COVID vaccine, be it Pfizer, Moderna. And if you can have access to one of those, I would absolutely get it, because the vaccine is very safe. Even though they've put a pause on J&J, remember, it's less than 1 in a million. That's the risk of these serious complications. And we really it's even serious complications were even less of an issue with Pfizer and Moderna. So I do think it's very, very safe. And I hope we've reassured people to get, the vaccine, putting J&J aside for now. Moderna or Pfizer are still out there.
Yeah, and they still haven't officially connected the dots between the blood clots having to do with the J&J vaccine. Dr. Sujatha Reddy, it's always so nice to see you. Thank you for joining us here on Morning Rush.
My pleasure, Sheba. Good to see you too.
Let's turn it over to Francesca now.